Hello, I'm Dr. Aria Morgan, and today we are going to talk about a topic that affects many men but is rarely discussed openly: erectile dysfunction and low energy. First, I want you to know that experiencing difficulties with sexual performance does not make you less of a man. It is not a reflection of your masculinity, nor is it a failure on your part. Erectile dysfunction, often abbreviated as ED, is a medical condition that has multiple causes. And the good news is that with proper understanding and treatment, it can be managed effectively. Low energy, fatigue, and lack of stamina often accompany ED, and these issues are usually interconnected with lifestyle, hormonal levels, and mental health. Addressing them together gives the best results and restores overall well-being. Erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for sexual activity. Many men may face occasional difficulties due to fatigue, stress, or temporary health conditions, and this is considered normal. However, when these difficulties persist for weeks or months, it becomes a sign that something may need attention. Often, ED is an early indicator of underlying health issues such as cardiovascular disease, diabetes, or hormonal imbalances. It is therefore essential to approach this condition with seriousness, not shame. Understanding your body, knowing the risk factors, and taking proactive steps are the keys to overcoming these challenges. There are several factors that can cause erectile dysfunction. Physical causes are among the most common. Cardiovascular problems such as high blood pressure, clogged arteries, and poor circulation reduce the blood flow to the penis, which is critical for achieving an erection. Diabetes can damage both the blood vessels and nerves, impairing sexual function over time. Obesity affects hormone balance, reduces testosterone levels, and limits energy and stamina. Chronic illnesses, including kidney or liver disease, can also interfere with sexual performance. Injuries to the pelvic region, spinal cord, or surgical interventions, especially those involving the prostate, may contribute to ED in some cases. Hormonal imbalances are another major factor. Testosterone, the male sex hormone, is essential for libido and energy. Low testosterone levels, which can naturally decline with age or due to medical conditions, can reduce sexual desire and make erections harder to achieve. Thyroid disorders, whether overactive or underactive, can also affect energy, mood, and sexual function. Hormonal balance is crucial not only for sexual performance, but also for overall health, including mood, muscle strength, and metabolism. Psychological causes play an equally important role. Stress, anxiety, and depression can directly reduce sexual desire and performance. Men often experience performance anxiety, where worrying about sexual performance itself causes difficulties in maintaining an erection. Mental health is therefore closely linked to sexual health, and addressing anxiety, stress, or depression can significantly improve outcomes. Chronic stress elevates cortisol, a hormone that suppresses testosterone, reduces energy, and can even affect cardiovascular health over time. Lifestyle factors have a profound effect on erectile function. Sedentary behavior reduces circulation and weakens the muscles needed to support sexual activity. Smoking damages blood vessels, reducing blood flow, while excessive alcohol consumption impairs nerve signaling and lowers testosterone levels. Poor sleep disrupts hormone production and reduces energy, making sexual performance more difficult. Diet also plays a major role. Consuming high amounts of sugar, processed foods, and unhealthy fats while neglecting protein, vitamins, and minerals affects both energy and libido. A well-balanced diet rich in nutrients is essential for maintaining sexual health and vitality. Men experiencing ED may notice various signs beyond difficulty achieving an erection. Reduced morning erections, low libido, fatigue, mood changes, irritability, and reduced physical performance are all common indicators. Recognizing these symptoms early is important because they may signal broader health concerns. Erectile dysfunction often does not exist in isolation. It is usually accompanied by other health issues that need attention. Addressing the root causes, rather than just the symptoms, ensures long-term improvement. Improving lifestyle factors is the first and most effective step in managing ED and low energy. Regular physical activity is crucial. Aerobic exercises like walking, cycling, swimming, or jogging for at least 30 minutes a day, 5 times a week, improve blood flow, cardiovascular health, and stamina. Strength training helps maintain muscle mass, boosts testosterone, and increases overall energy. Exercises targeting the pelvic floor muscles, known as Kegel exercises, strengthen the muscles responsible for supporting erections and improving control. Contract the pelvic muscles for 5 to 10 seconds, relax, and repeat 10 to 15 times, twice daily. Consistency is key, as regular practice improves muscle tone and sexual performance over time. Diet plays a central role in sexual health. Including sufficient protein from lean meats, fish, eggs, legumes, and dairy helps maintain muscle mass and supports hormone production. Healthy fats from avocados, nuts, olive oil, and fatty fish are essential for producing testosterone and other hormones. Fruits and vegetables provide antioxidants that protect blood vessels and support circulation. Whole grains such as oats, quinoa, and brown rice help maintain cardiovascular health and energy levels. Proper hydration is equally important. Aim for at least 2 to 2.5 liters of water daily. Dehydration can reduce energy, lower testosterone, and impair performance. Avoid excessive sugar, processed foods, smoking, and heavy alcohol consumption, as these negatively affect circulation, nerve function, and hormone balance. Sleep and recovery are critical components. Aim for 7 to 8 hours of uninterrupted sleep each night. Sleep deprivation reduces testosterone levels, increases cortisol, and lowers overall energy. To improve sleep, maintain a consistent bedtime and wake-up time. Avoid screens at least 30 to 60 minutes before bed. Keep the bedroom dark and cool, and limit caffeine late in the day. Quality sleep restores energy, improves mood, and enhances sexual performance naturally. Managing stress and mental health is equally important. Daily meditation or deep breathing for 10 to 15 minutes can calm the nervous system and reduce performance anxiety. Mindfulness practices help you focus on the present moment, rather than worrying about past or future performance. Counseling or therapy may be necessary if persistent anxiety, depression, or stress affects your daily life. Open communication with your partner about concerns, desires, and expectations reduces pressure and fosters intimacy. Journaling or sharing feelings with a trusted friend can also help alleviate mental burdens. Certain supplements can support sexual health and energy when used safely. L-arginine, an amino acid, can improve blood flow and support erections. Coenzyme Q10 promotes heart health and increases cellular energy. Zinc supports testosterone production, while vitamin D3 and B12 boost overall energy, mood, and hormonal balance. Omega-3 fatty acids improve circulation and reduce inflammation. It is essential to consult a healthcare professional before starting any supplements to ensure they are safe and appropriate for your individual needs. When lifestyle adjustments alone are insufficient, medical treatments can provide significant improvement. The most commonly prescribed medications for ED are PDE5 inhibitors, which include sildenafil, tadalafil, vardenafil, and avanafil. These medications increase blood flow to the penis in response to sexual stimulation, helping achieve and maintain erections. They should always be used under the supervision of a licensed doctor to avoid interactions with other medications, especially nitrates, which can dangerously lower blood pressure. Common side effects include headache, flushing, nasal congestion, and mild digestive discomfort, which are generally temporary. Testosterone replacement therapy may be recommended if blood tests indicate low testosterone levels. This therapy can be administered through injections, gels, creams, or patches. It improves libido, energy, muscle mass, and bone density. However, testosterone therapy should only be used under medical supervision, as inappropriate use can increase cardiovascular risks and hormone-related complications. Other prescription options, such as alprostadil injections or urethral suppositories, may be considered for men who do not respond to PDE5 inhibitors. Often, combining medical treatment with lifestyle improvements yields the best results. Daily habits and routines play a crucial role in sexual health. Avoid sitting for prolonged periods, as it reduces circulation to the pelvic area. Maintaining a healthy body weight supports hormonal balance and cardiovascular health. Regular health checkups to monitor blood pressure, blood sugar, cholesterol, and hormone levels are essential to prevent complications and ensure optimal treatment effectiveness. Avoid unverified herbal or online products marketed for sexual enhancement, as these can be unsafe and even life-threatening. It is important to address both physical and psychological factors simultaneously. Mental health directly influences sexual performance. Depression, anxiety, and stress reduce energy, lower libido, and can create a cycle of ED. Engaging in stress reduction activities, open communication with partners, and seeking counseling when needed are all critical steps. Confidence, self-esteem, and a positive mindset are powerful contributors to sexual health. By integrating these strategies, exercise, diet, sleep, stress management, safe supplements, and, when necessary, medically guided treatments, men can significantly improve both energy and sexual function. Remember, sexual health is not only about performance but also about overall well-being, quality of life, and confidence. Addressing ED responsibly and proactively restores vitality and strengthens relationships. Over time, consistent lifestyle improvements combined with professional guidance can help restore erections, increase energy, and improve sexual desire. Small, deliberate steps, daily exercise, nutrient-rich meals, proper sleep, stress management, and periodic medical evaluation accumulate to produce substantial benefits. It is never too late to take control of your health. ED is treatable, and low energy can be reversed with the right approach. By taking a comprehensive view, understanding the causes, implementing natural solutions, supporting hormonal health, and using medications responsibly under doctor supervision, men can regain sexual function, vitality, and confidence. Open communication, mental resilience, and proactive health management are key. Remember, seeking help is a sign of responsibility, not weakness. Prioritizing your health improves not only sexual performance but overall life satisfaction, energy, and longevity. Consistency, patience, and commitment to healthy habits yield sustainable results.